5 signs you need to have your teeth professionally cleaned. In this video, you'll learn the process of having your teeth professionally cleaned, and not just with this little toothbrush at home. And also show you the 5 signs that it's time to go ahead and make that appointment. Hi, I'm Dr. Langston. I'm an experienced prosthodontist and the director of Dental Implant and Aesthetic Specialists in Brookhaven, Georgia. And I'm here to help you watch your mouth. We have a team of amazing hygienists that have a lot of experience in treating mouths from a simple cleaning all the way up to a full mouth reconstruction or complicated implant restorations. They can show you how to take care of your mouth and keep it healthy in between appointments. Sign number 1, your gums look swollen. Gums are supposed to be pink and tightly bound to the tissue. Healthy gums don't bleed when you brush them. Sometimes gums can bleed for a variety of reasons: hormones, medication, trauma from chewing food that can lacerate the tissue. The good rule of thumb is that the occasional bleeding, and if you can pinpoint what caused it, is not a problem. But chronic repeated bleeding, you probably need to have checked out. Swollen gums are puffy, tender, sore to touch, and just generally make your mouth feel achy. There's a variety of reasons, and some of which can be plaque or calculus below the gum line that you can't get in there and clean out, so it's a chronic irritation of that tissue and it stays swollen and angry. There are many other reasons, such as an abscess of the tooth, a failing restoration, something lodged in the tissue. These are all things that need to be checked out and let us fix for you. Reason number 2, your gums bleed with even light contact. If your teeth bleed only rarely on special occasions such as trauma or another issue you can pinpoint, it's probably something you don't need to check out immediately, but keep in mind for your next hygiene visit. However, if you notice it's a common occurrence, as in every time you brush or every other time you brush, or even if the majority of your mouth is okay, but there's one area that's chronically tender and bleeding, you need to have us check it out. The most common cause of this bleeding is that inflammation caused by the plaque or calculus. Many times home care, while you put the best effort in, if that calculus is below the gum line where your toothbrush bristles can't get down to it, you need to come in and have us get in there, because we've got tools and materials that we can get underneath that gum tissue, reset everything, and help that tissue become healthy again. Other factors like medications or pregnancy can cause the gum tissue to be hypersensitive, swollen, and prone to bleeding. These are all things that if we know about, we can address and work around them. Number 3, your breath starts to drive people away. Bad breath, or halitosis, is the result of bacteria that have been left behind in your mouth that produce odor as they feed off left behind food particles. These food particles can be stuck in little nooks and crannies between your teeth, the grooves of your tongue, or even in the folds of your cheek. So that's why very thorough home care is important, to rinse all the food, all the bacteria out, to give your mouth a chance to be healthy. One key point to remember is to always brush your tongue, especially the back part of your tongue. A lot of people don't realize the deep grooves back there allow food and everything to accumulate, and even though your teeth are nice and clean, if your tongue has bacteria, you're going to have bad breath issues. There are plenty of oral hygiene tools that we can help show you how to use, from flosses, water pick, rinses, floss threaders, electric toothbrushes. There's lots of ways to get the bacteria and the food particles out of your mouth so that your mouth can be clean and healthy and your breath can smell natural. Reason number 4, cold things begin to feel unpleasant. Occasional tooth sensitivity is normal. I like to tell patients the mouth is a very weird place. It likes attention. Sometimes it flares up. Sometimes you get sensitivity, you get little zingers. As long as those are sporadic and occasional and the tooth calms down right after, it's generally not a concern. It's just the mouth being the mouth. If you have a tooth or an area of your mouth that's chronically sensitive to cold, to the point where you are actually changing your diet or changing where you're eating or chewing, that's something we need to check out. The majority of cold sensitivity is actually caused by gingival recession. So as we age, our bone kind of remodels and the tissue tends to drop. And so what happens is when that tissue drops below the gum line, you start to expose more and more of the neck of the tooth. And that root structure, unfortunately, is not as durable. It's not as defensive to the oral cavity. And so cold materials all of a sudden have a quicker pathway into the nerve. Fortunately, this is a very common problem and something that we treat every day in our practice. The easiest and most direct way is we've got prescription toothpaste. There's a couple of different brands that we use. The premise of these is they're highly fluoridated, and that allows the tooth to absorb more fluoride than you would normally get, and it helps rebuild a protective layer over the nerve. One thing to remember is that these are not instant fixes, but over time you'll notice within a week or two, with consistent use, you're going to build up that protective layer and you're going to see sensitivity decrease. The other option we have for sensitive teeth is a fluoride treatment. We have many patients that after their cleaning, our hygienists put a fluoride varnish on the teeth. And what this does, it's twofold. Number 1 is it holds the fluoride to the tooth so the tooth can absorb it over a longer period of time, but it also creates a protective physical barrier so those sensitive areas don't get zinged until the tooth has a chance to remineralize. Cold sensitivity is a great motivator to schedule a dental appointment. Reason number 5, your pearly whites aren't so white and pearly anymore. The oral environment is a rough environment. It's very harsh on not only your natural teeth, but any of the dental restorative materials we use. Normal diet and wear and tear are going to cause breakdown and staining over time. Often, a good professional cleaning done by one of our hygienists can do a really good job of removing the debris and stain that you can't quite get at home, even if you've got great home care. If the discoloration is more than just minor buildup and staining, we can discuss teeth whitening options to restore your teeth that natural white color. There are 2 kinds of cleanings that we provide at our office. The majority of our patients need a traditional cleaning, a prophy appointment, roughly every 6 months. We also have a subset of patients that have a history of periodontal disease and they need more attentive, in-depth, deeper cleaning, and we can discuss that a little bit afterwards. So the prophy cleaning is your regularly scheduled 6-month checkup appointment. At that appointment, the hygienist will clean your teeth, go over home care, go over your medical history. We'll also do a very thorough examination of your soft tissues, your existing restorations, your natural teeth. We'll do a cancer screening, and we'll also answer any questions or concerns you have about your mouth. We also do radiographs, also known as x-rays, at periodic times to make sure there's nothing going on below the gum tissue or underneath the crowns and in areas we can't see with our own eyes. I like to liken prophy appointments to getting your oil changed. It's something you need to do on a regular maintenance schedule to make sure nothing sneaks up on you and doesn't blow up on you. The last thing you want to do is have a major tooth problem that could have been prevented if you came in and let us check on it. So who needs a prophy appointment? Actually, everyone needs a prophy appointment. I like to tell my patients that from the time your teeth start coming in, 6 months, all the way through when you lose all your teeth, to our denture patients, you still need to come in and let us take a look for multiple reasons. Number 1, we need to check your gum tissue. We need to make sure the oral cavity is healthy. We can also clean your appliances and make sure everything doesn't have cracks, minor defects, or breakdowns. The old saying goes, an ounce of prevention is worth a pound of cure, and that could not apply more to dentistry. Oftentimes we have patients that come to us from another office that say they need deep cleaning, and they have questions about what that is and why they need it. Deep cleaning is also known as scaling and root planing, and these patients have deeper pockets and periodontal disease. The majority of our patients don't need a scaling and root planing. As long as they have good home care and they don't have a history of periodontal disease, which is basically bone loss, the combination of their home care and our hygienists at regular prophy appointments can maintain gingival health. However, there are patients that have bone loss and have deeper pockets that they can't get to and clean, and these are the patients that need regular periodontal maintenance. In this next video, you'll see the 5 biggest mistakes to avoid when whitening your teeth. I'm Dr. Brett Langston, helping you watch your mouth.
What if you get all gaggy?
Tough noogies.